law Democrats designed to fail, with former Louisiana Congressman Garret Graves, along with primary care physician, former U.S. Navy Lieutenant Commander, and Arizona Congressional Candidate Dr. Zuhdi Jasser. Gentlemen, welcome to you both. Congressman, your advice to Republicans who are considering that they might want to help Democrats save their party by throwing more good taxpayer money after bad and keeping Obamacare afloat. What do you say?
Chris, I think you nailed it in the opening. I mean, Obamacare has been an absolute failure. What Democrats are asking for right now is they're asking for a second level of subsidy. There's already a subsidy in place. Democrats during COVID put a second subsidy in place because they know that Obamacare is failing. It has failed. It is unaffordable. In addition to the other challenges that you laid out, inability to keep your doctor and other things that have made healthcare actually worse. So to come in and add a second subsidy or to demand a second subsidy is an admission of Democrats that Obamacare has absolutely failed in its affordability mission. I think Republicans need to stand their ground. In the Senate, you saw that Senator Thune tried to pay federal employees. Democrats objected. They've created this problem, and Republicans need to stick to their guns and demand that we move forward and open the government back up based on the appropriations proposals that have been put forward.
Okay, gentlemen, just hold on one second. I want to tell the audience a secret. I just don't want you guys to hear. The Democrats never wanted Obamacare to succeed. Okay, Dr. Jasser, over 22 million Americans are going to get steamrolled as healthcare costs reset to something you and I call reality without taxpayer dollars covering up the truth. And we all see the increases, and we're going to see some sort of level of increase. The Democrat plan was hoping Americans would be so stupid and so addicted to tax dollars that our people would demand that government take over our medical care. You know, this is the same Democrat-infested government that is screwing up air travel as you and I speak, the same Democrat-infested government that has cut off food stamp welfare. How do we convince our fellow citizens not to let their desire to have government help them blind them to government's enormous power to harm them?
Chris, you're so right. And as I talk to my patients every day that are worried about the cliff they're going to fall off every year when prices go up, insurance premiums are going to go up now 30 to 40%. And that's even assuming the CR is passed with the subsidies that are just absurd. So socialism proves to fail everywhere it's tried, because when the government prints money and prices go up, the people cannot afford it. Affordability is our issue as conservatives because we look at competition, we look at diversity in the marketplace. This current socialized healthcare system has consolidated the market. The hospitals and insurance companies have become the behemoth metaglomerates that don't care about the citizens. They are building billion-dollar infrastructures all over the country. In our cities here in Arizona, buildings are rising with new hospitals, et cetera. They're rife with cash, and they say they need subsidies because their insurance is not paying for Medicaid and other things. They're doing that on the back of the taxpayers. We need reform. Yes. We need price transparency and free market
I'm going to get to that.
System.
Yeah, Dr. Jasser, I'm going to get to that here in a second. I just want to wrap up another line of questioning here, and I'm going to come right back to that to you, as a matter of fact. Congressman, rhinos who were in charge during the Obamacare debate forbade the Republican Party. You may have seen it. They forbade the Republican Party to consolidate around a free market plan, one that would give Americans a choice, over Obamacare. Knowing that you can't beat something with nothing, how would you counsel your former congressional GOP colleagues to go forward from here?
It's a great question. I think Dr. Jasser laid out some fundamentals that are absolutely critical in any Republican plan. Look, the United States has thrived because of capitalism, because of competition, because of transparency. None of those principles apply to our current healthcare situation. You go to the pharmacy, you have no idea if you're walking out by paying $10 or paying $1,000. You go and get a medical procedure done. You don't have any idea how much it's going to cost. And of course, with medical surprise billing and other challenges, our pharmaceutical costs are way out of whack with the rest of the world. And we currently spend $15,000 a person in America for healthcare. The next closest person, next closest country is 9,000. Dr. Jasser laid out the fundamentals. That is exactly what Republicans need to do to allow capitalism, to allow free markets to do what they do and bring down prices.
Yeah. Well, Dr. Jasser, I've only got about a minute left, and you're going to solve healthcare for me in a minute. Dr. Contessessa told me last night that Americans need to abandon the idea of health insurance. He suggested that we resurrect the affordable catastrophic loss policy market that was destroyed by Obamacare, as you know, to handle big medical challenges like cancer or getting hit by a bus or something like that. And meanwhile, we should be demanding that our congressional fake leaders allow us to deduct our routine medical expenses like checkups and sick visits from our tax returns, or better yet, pay for those things with health savings accounts. What do you think about those solutions?
Yeah, I mean, any infusion in which patients can vote with their feet, go to the best doctors they want based on what they want to pay, so that we can have price transparency, so that I can get paid the same that the hospital across the street gets paid for the same procedure. These types of things, instead of favoring billion, trillion-dollar companies, but allowing us to compete in the small business area, is what will be the solution. Insurance companies aren't too big to fail. They need to have the same pressures that I do when I have to pay my payroll every 2 weeks in order to continue to survive, while they can't get relying on subsidies and let patients decide with their feet who they want to go to and what they want to pay for with their HSAs and otherwise.
Another little, oh, hold on, guys. Another little secret. The Democrats gave billions, trillions to insurance companies through Obamacare. Garret Graves, Dr. Zuhdi Jasser, gentlemen, thank you very much. Appreciate the time.